My name is Victoria Franklin. I'm the Director of Nursing for ABMU Health Board and also the Executive Lead for Infection Prevention and Control. The Health Board is fully committed to implementing the 1,000 Lives Plus S.T.O.P campaign, which aims to reduce hospital-acquired infection for patients that have a urinary catheter or peripheral cannula in place. Urinary tract infections are the third most common hospital-acquired infection in Wales and account for 16% of our infections. A recent audit has identified that 7.3% of patients with a peripheral cannula have had an infection. Of course, patients require appropriate treatment, and as a consequence they do require insertions of urinary catheters and peripheral cannulas, but we need to make sure that we manage those most effectively and appropriately so our patients don't have infections. So the S.T.O.P campaign enables us to stop. Does the patient require a device? We need to think about the care and the attention to detail in caring for that device. Are there alternative options? And also about preventing healthcare-acquired infection by making sure that we insert the device appropriately, that we care for it appropriately and manage it. So the S.T.O.P campaign is very important for us because what we know is that patients will not have infections, that their harm will be reduced, and most importantly, we will be saving lives as part of this campaign.
So I hope that everyone will engage in this really good initiative to help with patient safety. So I'd encourage all medical, nursing and allied health professional staff to be aware of this and to support us in our aims.
Thank you, Doctor, for taking such good care of me. Without the NHS, I really don't know how I'd be. I watch the staff as they hurry from bed to bed, taking care, washing hands so bugs don't spread. Doctor, please, I know you are fantastic, but before you make the so plastic, think it over. Is there another way to get over? Give my drugs today. Stop in the name of bugs before you do me harm. Stop in the name of bugs before you do me harm. Think it over. Talk it over.
The S.T.O.P campaign is a really simple concept. It's about asking us to stop and think. Hospitals should be places of safety for vulnerable people, but of course we know that unintentionally harm can happen. And one of the most common ways this happens is through the use of cannula and catheters, where sadly sometimes infections can arise. So what the campaign is about thinking about whether these are being used appropriately and making sure that if they come to the end of their useful life that they're taken out or that they're not put in the first place. So the S.T.O.P campaign is about stopping and thinking and making sure that that particular intervention is really necessary. And I would encourage you all to get involved in the S.T.O.P campaign because I think it might help us make sure that our hospitals are safer places for vulnerable people.
Hello, I'm Andrew Davies. I'm Chair of Abertawe Bromwell University Health Board, and along with my Chief Executive, we want everybody to sign up to the S.T.O.P campaign. We want you to stop and think about whether some of the work you're doing is absolutely necessary, whether you need to insert a cannula or a catheter, because we know from the evidence that actually in many cases it's unnecessary and can lead to infections. So it's about following best practice, obviously using your judgment, and we know it's about providing a better service for our patients. We very much hope you can support the campaign and look to continue the really good progress we're making in ABMU.